Hello friends. Today we are going to discuss about boundary violation in psychiatry. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about what is boundary violation, what is boundary crossing, what is sexual boundary violation, and what are the impact of this boundary violation, and how to prevent boundary violation will be discussed in this video. Let's understand about boundary. If the doctor or the therapist patient relationship, a boundary is defined as the limit of safe and effective professional relationship between a physician and a patient. Boundary defines the limit in the doctor patient relationship, or it can be therapist patient relationship. Boundaries serve to protect the patient from exploitation or harm by the healthcare provider. Boundary exists because the relationship between the client and therapist is fiduciary in nature. That means there is a power imbalance. The doctor or the therapist has extreme power, whereas the patient has a low power and he presents himself in a crisis or in a vulnerable situation. Further, he will share his inner thoughts, emotions, and behavior to the therapist or to the physician. In such a scenario, where the patient is vulnerable and also in a crisis, and sharing is all his inner thoughts and emotions, in such a scenario, the boundaries needs to be clearly defined. And this boundary is becoming blurred because of social media. That means the doctor and the therapist are on social media, and the patient interacts with the service provider. Further, organization and institutions, they are also on social media. Interaction between the patient and the organization or the people who are representing the organization. And in small places like village, the therapist or the doctor cannot avoid the patient. He may bump with the patient in a social situation, maybe in a temple or a church, or maybe in a market. Although he may try to avoid, the patient may recognize the doctor or the therapist may try to talk to him. In such a scenario, the therapist or the doctor cannot ignore and walk away from that place. It looks completely and socially awkward. Hence, defining the boundary and also working within that framework in the best interest of the patient plays a role. Given this fiduciary nature of this relationship, where the doctor or the therapist in the higher power and the power imbalance which exists where the patient is at the receiving end, it is the complete responsibility on the doctor or the therapist to uphold the boundary so that the trust, respect, and integrity of care, so that the patient's boundaries are not violated, undue advantage is not taken, and the patients are not exploited. This is very essential in any healthcare sector. And these boundary violations can be sexual boundary violation and also non-sexual boundary violation. This can occur with patient and physician, or maybe therapist and patient. Now, what is about boundary crossing? Boundary crossing are minor excursions from this line which are not harmful, indeed, in situation inevitable or even appropriate. Sometimes some of the researchers say boundary crossings are not harmful. Rarely it may become harmful, or else it may become a boundary violation. But however, minor boundary crossings at times may be therapeutical in nature. For example, if the patient is unable to afford a therapy, and the therapist reduces the fees of that patient, but it takes full amount from everyone. Suppose he is decreasing the price for specific patient for specific reason, that can be considered as boundary crossing. Sometimes the patient has undergone therapy, he has improved well, he passed the exam, or he has got a job. He brings sweets to share the joy. In such a scenario, the therapist, should he accept the sweet or should deny? If he accepts the sweet or the chocolate, the boundary crossing can be considered. Further, if a patient who is a young child who had severe social phobia, the therapist has treated successfully. Now the child is performing the first dance. Now the patient and the patient family members are requesting the therapist to be present in that social gathering where the small child is going to dance. Should the therapist accept or not? If he accepts, it can be considered as a boundary crossing. Further, treating your own student. For example, you are working in a medical college and your student is suffering from a depression and you are treating. Now you have a dual role. One is a teacher and the other one is a therapist. Similarly, a friend becomes a patient over a period of time, or the patient becomes your friend. Friend's family member become your patient. So these dual relationship and boundary crossings can occur anytime. So if you look at the potential non-sexual boundary crossing can be considered, for example, excessive self-disclosure. Here the therapist talks about his life, about his relationship, about his thoughts, and decreasing the fees for a specific patient, extending more time to certain patients. Invariably, it is 40 minutes therapy, but here the therapist will spend 1.5 hours, allowing telephone calls in the odd hours with the patient, having a relationship with the patient regarding business, socializing with the patient, having coffee outside the working hours in a cafe, calling the patient by first name, or else the patient calling the doctor in the first name, treating the patient as a friend, sometimes touching the patient or hugging the patient. So these can be considered as a non-sexual boundary violations. Boundary violations occur when a therapist or a physician does not establish and or maintain the limits of professional relationship with their patient. These boundary violations can be, for example, if the physician or the psychiatrist takes the loan from the patient, starting business with the patient, having money transaction apart from therapy or consultation, having sexual relationship with the patient, dating patient's family members, receiving costly gifts from the patient's father or the patient family members. These are all can be considered as boundary violation. In this, the serious one is having sexual relationship with the patient or with the patient family members. Invariably, boundary violation ends up in exploitation of the patient, either in the short term or in the long term. And this can also have a serious consequences on the profession. It's not only the patient. Imagine if the society comes to know about this relationship, the trust, the integrity on the profession will come down. Hence, this is not only has an impact on the patient, but also on the profession. Due to the inherent power imbalance which is there between the therapist and the patient, it is the responsibility of the doctor or the therapist not to exploit the relationship, either for personal gain or for social gain, economical gain, or sexual gain, or any other gain. The patient should not be exploited at any cost, and the best interest of the patient should be upheld. Now, let's talk about boundary crossing and violation. This can occur either by the patient or by the patient family members. They are vulnerable. The patient feels that the doctor is a hero or the therapist is a hero who is come as a savior. They may start having a romantic thoughts, feelings towards the therapist or the doctor. They are vulnerable. But at the same time, it can also start from the doctor or the therapist. They are in a powerful situation. They are the service provider. So it can occur from either way. Hence, considering the power imbalance here, it is the complete responsibility of the doctor or the therapist to say no, even when the patient says yes for sexual relationship. That means it is completely no. The doctor and the therapist should never have any kind of sexual relationship with the patient. Now let's understand various boundary violation concepts. Let's look into this diagram. This was given by Glass and his colleagues. And if you look at the diagram, it talks about various boundary violations. First one is boundary crossing. Here, it's a non-progressive departure from the established treatment that are aimed at adapting treatment to an individual patient. For example, if the patient says he has agoraphobia, he cannot go in a crowded place, the therapist will lead the patient into a crowded social situation. That can be considered as a boundary crossing, but it is a therapeutic in nature. The second one is very minor. It is boundary crossing in a gray area. That means here, reducing the pay structure to the patient or scheduling the therapy in a cafe or non-therapeutic places, maybe in the hotel. The third one is aggregated boundary crossing. That means numerous crossing that in combinations begin to border on malpractice. The fourth one is boundary violation. Here the clear violation of professional ethics occurs, my dear friend. It can be sexual, it can be physical, it can be dual relationship. Fifth one is boundary violation in a gray area. Here, therapist initiated actions that depart from established practice. And the sixth one is pseudo boundary violation. Here, the patient perceives wrongly that the boundary is violated. In fact, the therapist is highly professional, but it is the patient's perception, and it can lead to a wrong complaint against the doctor. Now let's understand about boundary crossing or violation by therapists. What are the reasons? What are the factors? Norris and his colleagues established some of the factors. If the therapist is in life crisis, he has been diagnosed as cancer. If the therapist is having a marital problems, or else he's having economical crisis, his child has been diagnosed to have severe mental illness or some or the other crisis he's going through, then he's vulnerable. If the therapist is changing the job or the doctor has lost the job and is doing only few private practices, if he has been diagnosed with mental illness or any other illness, arrogance by the therapist or the doctor, or if there is a stress points by the patient, can also lead to boundary violation. You can see various factors have been mentioned here, such as therapist in crisis, isolation and practicing, narcissistic traits of the therapist, impulsivity of the therapist, countertransference, and he's unable to handle that, emotional vulnerability by the therapist, moral weakness, failure to recognize power imbalance by the therapist, ignorance and lack of training. So these are all can lead to boundary violation from the therapist end. What about the factors by the patient and patient family members? Again, you can see various factors have been enumerated. Of course, the patient is vulnerable, he's seeking help, the power imbalance is there. Suppose the patient has various personality disorders like borderline personality disorder, dependent personality disorder, antisocial personality disorder, impulsivity. If the patient feels gratitude towards the doctor, he needs to do something good for the doctor or to the therapist. Unrealistic belief about the therapy and trying to offer themselves to the therapist. Childhood sexual trauma of the patient, social isolation and dependency by the patient on the doctor, economic issues, blackmailing by the patient to the doctor, malingering, all these can play a role in boundary violation, my dear friends. What about the ethics in boundary violation? If you look at the ethics, beneficency, autonomy, and non maleficency are all being thrown into the air when boundary violation occurs. Especially in beneficency, it is the duty of the clinician to act in the best interest of the patient. If you do any kind of boundary violation, the receiving end is at the patient. And again, non maleficency, do not do any harm to the patient. Autonomy, the patient's right to self determination and informed decision making should be upheld. Hence, considering all this, under no circumstances shall a therapist or a psychiatrist engage in any form of boundary violation. The ethics needs to be upheld, my dear friends. What about the prevalence? If you look at the boundary violations can be either physical, emotional, or else maybe sexual, non-sexual. Sometimes it can be subtle and it is very subjective in nature at times and difficult to measure. However, the studies from the Western country and North America have reported about the sexual boundary violations, where the complaints are registered in the professional bodies. Although the exact prevalence may be higher, the complaint to the professional bodies may be very less, but this is the best prevalence we can get. The available data from North America and other Western country report 6 to 10% of sexual boundary violation occurs with doctor and patient relationship. Based upon the definition, it may increase. If you want to ask the doctor, they will never say, yes, we have done the violation. If you talk to the patient, they may give more prevalence. Hence, it is very difficult to assess the exact nature of boundary violation and prevalence. But however, it is there. Now let's look into the role of culture, religion, and generation gap in boundary violation and crossing. Of course, social, culture, and religious factors do play a crucial role. For example, the way the patient dress or the therapist making eye contact with the patient or touching the patient in certain religion is not allowed, in certain culture it is not allowed. Gender role in a society. If the female patient comes to a doctor who is a male, how the male doctor behaves with the patient, shaking hand with the patient in Eastern countries is not accepted. It is invariably namaste gesture is the one which is accepted in our tradition. Further, the current younger generation becoming friendly with the patient on social media is also can be considered as a generation gap, imposing the therapist's own religious views, cultural views, food views, what to eat, what not to eat, commenting on homosexuality, third gender, sexual reassignment surgery, refusing to do therapy. Dual relationship is another biggest problem. Here, the treating psychiatrist may have to play two roles, dual role. For example, he's a treating psychiatrist and also a teacher for that student. So in such a scenario, it becomes very difficult. Now let's understand role of certain therapies and boundary violation. In certain therapies such as psychodynamic psychotherapy, couple therapy, emotion focused therapy, and sexual therapy, here it is a high risk if the therapist is not properly trained and if he is unable to handle transference and countertransference, and also the emotional discussion which occurs between the patient and the therapist can lead to boundary violation. Hence, these are the therapies which is very high risk. On the other hand, structured, time limited CBT, IPT, behavioral therapy, IPSRT, the boundary violations is very less compared to psychodynamic psychotherapy, my dear friends. So even the type of therapy also play a role. What is the impact of boundary violation? The boundary violation impact is directly on the patient. It can be short term and long term. Short term may be shame, guilt, confusion and anxiety by the patient. Further, loss of trust, emotional distress, fear, breakdown of therapeutic relationship, reduced treatment efficacy. These are short term. Long term, the patient may develop chronic depression, PTSD, suicidal ideation, attempted suicide, death by suicide, personality changes, emotional numbing, reluctant to seek future help because the therapist has violated him, distrust with the healthcare professional. These are the things which is going to happen in the long run. Further, isolation, withdrawal from therapeutic relationship, aggression, dependency, avoidance, impaired daily functioning. Further, the patient may also have in long-term difficulty in maintaining relationship, forming relationship, substance use, drug abuse, long-lasting impairment in social and occupational functioning, my dear friends. Hence, the psychiatrist may lose license to practice if there is a boundary violation and the patient gives complaint. Further, malpractice case, economical compensation has to be paid, and a criminal case can also be lodged against the therapist or the psychiatrist if they violate the patient. Now, the question is how to manage the patient with sexual boundary violation. The patient has been violated by a previous therapist and he is asking for help. How to go about managing the patient who have experienced sexual boundary violation by a previous therapist and he is asking for help. You need to be very well trained in dealing such patients, my dear friend. It's a very sensitive matter because the patient has been let down by the same system where he had came for help earlier. And now there is a huge responsibility on you not to let the patient down. Further, provide care with compassion and offer legal help, legal advice, legal referral, and also other remedial measures as the patient requires. Further, initiate proceedings against the professional who has violated the patient. Now, what are the preventive measures which can be adopted so that the sexual boundary violations does not occur? First and the foremost, improving the awareness about boundary violation to all stakeholders, that is doctor, nurses, administrators, patients, family members. Imparting training to the medical students, nurses, and various other mental health professionals is very essential. Even if the patient says yes for sex, the healthcare provider should be very clear. He should say no because in the fiduciary relationship, the healthcare provider's power imbalance, his power is very high. He has the authority to stop it so that the patient has come for healing and you need to provide healing, not to take advantage of the patient. Further, professional guidelines should draft boundary violation guidelines. What are those? What are the punishments? And needs to be publicized in internet and all newspapers. Do proper referral check of the professional if you are going to hire them. Sexual boundary violation by a colleague should not be tolerated and it is not negotiable. Complaint should be immediately done. Mechanism to expose the perpetrator should be made simple. Dealing the dual relationship needs to be very cautious. It is a slippery slope. For example, if he becomes a patient, should you treat or should you refer? If a patient becomes your friend, or else if the patient is going to be your business partner, in such a scenario, you have to be very careful and you need to prevent from all possible angle. Treat the survivor of the sexual boundary violations compassionately. If needed, provide all support, services, appropriate referral, ensure people investigating sexual boundary violations are properly trained, exercise caution while interacting with the patient on social media, my dear friends, because many a time the patient may ask certain sensitive matters on social media. So you have to be very careful when you are answering. So, what are the last do's and don'ts? Know your state statute regarding boundary violation, update yourself regarding the professional ethics, consult with colleagues whenever you have doubt, be aware of your weakness, avoid slippery slopes, use objective documentation, and also build a satisfying personal life. Don't foster dependency. Please try to empower the patient. Don't use patient for your own gratification. Under no circumstances you should not try to exploit the patient. Don't engage in extra therapeutic relationship with the patient. Avoid physical contact with the patient. Don't accept gift or any other services by the patient or patient family members. Recently, Indian Psychiatric Society has come up with the draft guidelines for doctors on professional boundaries, which was released on 23rd December 2024. It is yet to be notified, but however, the previous 3.6 is applicable, but the current version is 3.7. To conclude, my dear friends, in any kind of doctor patient relationship or therapist patient relationship, erotic feelings or romantic feelings are common. And very rarely it becomes a real sexual boundary violation. Approximately 10% of the therapist takes advantage of the patients. Here, the responsibility is completely on the doctor or the therapist. Because of the fiduciary relationship, the power is with the doctor, so he has to say no. Hence, educating the doctors, therapists, nurses, making aware of them, and also supervising the therapy is very essential, my dear friends. Under no circumstances, under no pretext, should a sexual boundary violation be done, my dear friends, and it should not be tolerated and it is non negotiable. The exploitation of the patient must be stopped at any cost to protect the patient's safety and uphold the highest ethical standard in the healthcare, my dear friends. Not only that, healthcare profession is a noble profession. We should not allow to tarnish the image of a profession, my dear friends. Thank you very much for giving your valuable time. Stay safe.